How is it that we find ourselves surrounded by such complexity, such elegance?
The genes of you and me, the genes of you and me, are all made of DNA. We're all made of the same chemical DNA. We're all made of DNA.
Hi, you're listening to DNA Today, a podcast and radio show where we discover new advances in the world of genetics. From genetic technology like CRISPR to rare diseases to new research, we have you covered. For a decade, DNA Today has brought you the voices of leaders in genetics. I'm Keira Deneen. I'm a certified genetic counselor and your host. This episode, we are exploring Blueprint Genetics' My Retina Tracker program. I am joined by two lovely guests here. My first guest is Khalida Liaquat, who is a genetic counselor and the senior manager of genomic services at Quest Diagnostics. Our other guest is Ariana Lichtenstein, who is the director of business development at Blueprint Genetics. Thank you so much for joining me.
Thanks for having us.
Thank you so much for having us. So excited.
So we have a lot of fun topics to get into. Again, we're focusing on the My Retina Tracker program. So tell me about the program and the registry that goes with it. I don't know who wants to kick off the conversation here.
Ariana's going to take it up.
All right, Ariana, tell us about My Retina Tracker program.
Yeah, I can take that one for sure. So the My Retina Tracker program is a sponsored testing program. It's actually the first sponsored testing program that was developed and launched by the team at Blueprint Genetics. So you're probably familiar, but for those not familiar with the term sponsored testing, that sort of means that there's no cost to patients or the health care industry, healthcare providers, insurance companies. It's funded or it's sponsored by a third-party entity. So the My Retina Tracker program itself was a collaboration between the Foundation Fighting Blindness, us at Blueprint Genetics, and Informed DNA to provide some genetic counseling services. And it's specifically for patients with inherited retinal disease. So those are things like retinitis pigmentosa, Usher syndrome, Stargardt disease. So there's a clinical diagnosis of one of the IRDs, but there's no underlying molecular diagnosis. So we don't really know what's causing it genetically. And this program was kind of developed to increase access to genetic testing services for those patients. And one of the important features was the development of the My Retina Tracker registry, which is super unique to our program.
So tell me a little bit more about the registry part then. So people are able to have this testing and there's no cost to the patient. Am I getting that right because of the way it's set up?
Correct.
Okay.
Exactly. There's no cost to the patient.
So how does the registry part work? Once they've done testing, they're part of the registry and part of that database?
Sometimes. So the participation in the registry itself is completely optional for patients. So it's an optional component of the program, but it's not at all a requirement. So after a patient undergoes testing through the My Retina Tracker program, they could potentially be contacted by the Foundation Fighting Blindness to provide additional information about how to sign up for the registry. So there's a few different ways that they can sign up. The counselors at Informed DNA are equipped to kind of provide services and provide help for those patients to get enrolled. There's also personnel support at the Foundation Fighting Blindness level as well.
Okay, interesting. So then how does the foundation that's linked to the registry, what does the role of the foundation have in all of this?
Yeah, that's another great question. So FFB is one of the sponsors of the My Retina Tracker program. They were actually one of our initial collaborators. So in addition to the Foundation Fighting Blindness, we now do have some BioPharma collaborators, which is a little more typical of a sponsored testing program here in North America, would be to be funded by a biopharmaceutical entity that's trying to develop a therapeutic, recruit patients either for clinical trials or recruit patients for, who would potentially be, amenable to that therapeutic intervention. So the foundation kind of sets up the registry. They have people who are able to help the patients get involved and enrolled into the registry, and they manage the registry itself on the clinical trial side. So they work with the different biopharmaceutical companies to query their database and see if there's patients who have certain underlying genetic causes who would potentially benefit from enrolling in a clinical study or trial.
Which I think is a little bit more typical, right? The advocacy groups tend to be the ones that fund and manage registries. So that's what we're seeing here. FFB is the one that administers and founded the registry for retinal disease in this case.
And as you guys are highlighting, the registry can be really helpful in terms of having a patient enrolled in a clinical trial, because then they're in a database to be able to be pulled from and saying, okay, who would be good for this clinical trial? Who matches the requirements for that? And then if you're in the registries, that's leading the way for that. So it seems to be that's one of the biggest advantages of being in the registry. Is there anything else that patients should be aware of in terms of being a part of the registry or other benefits?
That's a soapbox question for me. Like, I love geeking out over registries. And
all right, let's hear it, Cal.
So there's actually a body of scholarship and work in the literature talking about the benefits of registries, in particular in rare diseases, right? So when we think about rare diseases, and if we think about retinal disease in particular, each of those diseases that Ariana mentioned individually are rare. But when you take a step back and think of them as conditions that affect the retina, collectively they're a lot more popular or more common. And so if you think about registries as a place to connect, first and foremost, to connect families, to connect individuals, and to connect clinicians in rare diseases, that's an advantage right there, right? Because you've got some conditions that are like 1 in a million. You might never find another individual with the same characteristics or symptoms. Now you enter the registry and you might be able to find someone who has the same condition as yourself or as your child. As a clinician, you might never see someone who has a rare disease, and then you do. So where do you go? What do? You would go to the literature, and if there's a registry, you can go there, query to see, well, what can I expect? Like, what does the picture look like? And when we start thinking about the natural history of conditions that are rare, there's not a ton of data there. So we might know some information about presentation and onset, but we might not know what the condition looks like over the course of a lifetime. And so that's where the registry comes in, right? It's a place where there's information that is required or requested in a structured manner. And so as patients and families interact with the registry, we're collecting what's called real-world data, as opposed to clinical trial data, which is very set in stone as to what it is that we're looking for in what type of patient and what it is that we're recording. In a live registry, the patients are bringing information forth. And so that benefits the family, it benefits clinicians like ourselves, it benefits researchers that are interested in solving problems, looking for a treatment, eventually the C word, a cure. And so now if we have a group of patients and families in a registry, we're collecting natural history data. So we might end up knowing endpoints to what clinical trials are, right? And we might know what success looks like. If we're going for a treatment or an assisted device, what does success look like when we're testing? Number 2, 3, 5, I'm not sure what I'm at anymore.
A million.
And so registries are a great way to connect. They're a great way to collect information. And depending on the registry and the rare disease, it could be anonymous or it could not be anonymous. It really depends on the type of registry we're talking about. Ultimately, it helps researchers, clinicians work towards advocacy, treatment, and maybe even a cure. So I could go on, but the body of literature around this, repeats itself over and over in every single disease. And it's really interesting that for retinal disease in particular, we have a registry that works. Patients, whether they test positive or negative or with a variant of unknown significance, are eligible to sign up for the registry, because having a diagnosis, right, is what makes you eligible to participate in all of this. So even in the context of a diagnosis but not a molecular genetically positive report, those families and patients can still register and be a part of that community. I'm going to stop right there.
There are so many benefits. Like, I think that's just a great capture of not just for retinal diseases, but in general too. A lot of that applies to so many different genetic disorders and rare disorders. Mm-hmm. One aspect that I want to pull out of what you just said was that people can either be anonymous in there or be identified. Can you talk about the privacy issues surrounding that? If a patient is not anonymous, what someone should be concerned about? And if they are anonymous, I mean, how de-identified is DNA, right? Like, at what point can we really say, oh yeah, this is anonymous? Because can't you always trace it back to the person?
Yeah, that's such a great question and such a hot topic. And An issue that's really important to the team at Blueprint Genetics, and I think it's a great point because different laboratories, different registries use data differently. So at Blueprint, we were founded by clinicians for clinicians. It's one of our central tenets. And so patient privacy and data sharing is, we do err on the conservative side, and we're proud of that. So the entire patient privacy and data sharing aspects of the My Retina Tracker program are outlined explicitly in the program informed consent document. So patients are going to know upfront before they even submit a sample to get their testing done, kind of what they're signing up for. If they're not comfortable with that, there's no pressure to participate. They can withdraw their consent at any point in time. And I think it's important to realize that that process is separate from the My Retina Tracker registry. So they go hand in hand, but the My Retina Tracker registry also has its own informed consent document that's available on the Foundation's webpage. And the patient goes through that. There's a few different supports for visually impaired with screen readers and, different ways to make sure that, the visually impaired community is able to, again, really understand what they're consenting to. They don't have to sign up for the registry by, participating in the program. Alternately, they don't have to participate in the MRT program to sign up for the registry. The registry is run by FFB. It can be, entered or enrolled in at any point in time. So the information that patients input into the registry may be identifiable in nature with things like a name, a date of birth, but the information that is shared outside of that registry with external sources, such as a biopharmaceutical company, is completely anonymized. So there's no sharing externally. The registry itself is what it is, but the data sharing outside of that is very protected. And any data that we at Blueprint share through the program with our sponsors is completely anonymized and de-identified, so that there are no concerns for the patient privacy aspect. But something we're really, really passionate about.
Yeah, and certainly something that you want to make sure you're checking all the boxes so patients and their caregivers possibly feel 100% comfortable with doing the testing, which is what we, as genetic counselors all want to see. Obviously, if we're onboarding patients to do any of this testing. PerkinElmer Genomics is a global leader in genetic testing, focusing on rare diseases, inherited disorders, newborn screening, and hereditary cancer. Testing services support the full continuum of care from preconception and prenatal to neonatal, pediatric, and adult. Testing options include sequencing for targeted genes, multiple genes, the whole exome or genome, and copy number variations. Using a simple saliva or blood sample, PerkinElmer Genomics answers complex genetic questions that can proactively inform patient care and end the diagnostic odyssey for families. Learn more at PerkinElmerGenomics.com. If you're applying to genetic counseling grad schools in the near future, I highly recommend checking out Sarah Lawrence's Why Genetic Counseling Wednesday Summer Series. This is the third year Sarah Lawrence will be hosting this series, where you can interact through Zoom with genetic counselors from different specialties for 2 hours every Wednesday in June. It kicks off on Wednesday, June 1st at noon Eastern. As many of you know, I graduated from Sarah Lawrence's program 2 years ago, and the series was a fun way to interact with prospective genetic counseling students. I'm really looking forward to meeting more of you during this series. Myself and fellow genetic counselors will share about our roles and answer your questions live. Not only will you hear from genetic counselors in a variety of specialties, you'll also have the opportunity to discuss ethical and social implications of genomic medicine, engage with current students, and learn about the exciting present and projected future of the profession. Anyone who attends all 5 will earn a certificate of completion and receive an application fee waiver for the grad program. Register now before we are fully booked. Go to slc.edu/DNA today. Again, that's slc.edu/DNA today to be part of this interactive genetic counseling experience. So if a patient is opting into the registry, are they doing that through their healthcare provider, such as a genetic counselor or physician that's ordering the testing?
Oh, there's so many different workflows there, Kira. That's such a great question. So We've actually we're in the process of developing a workflow that involves the Foundation Fighting Blindness. It's called the My Retina Tracker Registry Information Session. So this is a great solution for those clinics that maybe don't have a genetic counselor in-house, or they have a genetic counselor, but the genetic counselor, isn't familiar with the registry platform and, doesn't want to get familiar with it because busy doing the counseling and things like that. So if patients sign a HIPAA authorization form, that basically provides their consent to be contacted by the foundation, by a foundation person to help them get started with the registration process. And that consent can be given either at the time that a sample is collected for the program and sent to us at Blueprint, or it can also be provided retrospectively. So we're seeing that there's this huge population of patients that were previously tested through the MRT program who didn't even know that the registry resources were available. So at any point in time, they can go back and kind of sign this HIPAA authorization form. It's available through us on our website. We have a great sales team, a commercial team that interacts with retinal clinics all around the country that, those field folks also have kind of access to that form. But I think the main point is you can either opt into the registry at the time of testing or after the fact as well. So they're intertwined, but they're also separate enough that whatever workflow works for the patient and the counselor and the clinic also works for us in the foundation. The goal is just to get as many patients as possible into the registry, and that kind of goes hand in hand with the foundation's overall goal, and the foundation just wants to keep driving research forward. They're looking for those treatments, those preventions, the big C word, as Cal said, the cure. I remember 10 years ago when I started in this industry, we were nowhere close from the standpoint of precision medicine. We were just hoping to make diagnoses, but we had no idea what the diagnoses meant. That was enough, was the answer. But now knowing that there's more that can be done with that answer is just, it's just so empowering for patients.
So one thought I just had to chime in, Ariana, is patients might have been tested in the past prior to there being a little bit more fanfare about the registry or knowledge. So I'm wondering if a patient thinks they were tested or maybe doesn't know if they were tested. So two thoughts I had is, one, obviously they can go back to their clinicians, but maybe they could also reach out to a laboratory they thought maybe they were tested at, in this case Blueprint, to locate that report and find out, did I have a result, what my results were. I'm a terrible historian for my own health, so just thinking in terms of how would I even know if I had a report laying around somewhere. So those are two things, because you don't have to have been tested in the last 6 months in order to think even about entering the registry. You could have been tested 3 years ago and wanting to join now to make those connections.
And in terms of go ahead, Ariana.
Oh, sorry, Kira. The registry itself, you can either enter the information, and I can imagine for patients, lay people, it's overwhelming genomic information, transcript, variant classification, visually impaired on top of it, you're trying to enter information into a field. So the registry makes it really easy to upload copies of, PDF of the clinical statement that went out from the laboratory, or to kind of prompt your provider, your healthcare provider. If the healthcare provider has a registry account as well, the healthcare provider can upload that report on behalf of the patient if the patient asks them to do so. The registry is really kind of interactive and cool from that standpoint. Then again, there's lots of different workflows. If you have access to the result report and you want to input that information line by line, go right ahead. But if you just want to upload a copy of the result, go right ahead.
Yeah, certainly making it easy for healthcare providers to send patients and share all of that information, because we're all doing it in different ways. Some people are paper-based, some people have the EMRs, EHRs. So we're all, at this point right now, at least in the US, we're all kind of all over the place. Now, in terms of who is ordering this testing, obviously we've been talking about healthcare providers, genetic counselors. Do you see that it's mostly GPs and genetic counselors, or what are you seeing in terms of who the ordering providers are? Because obviously the patients are people that have eye disorders. Mm-hmm. Are you seeing ophthalmologists order this as well? Are they getting into the genetic testing area?
Yeah, so I think that's a great question for like more of our commercial team, but I was on our commercial team for a little bit, so maybe I'll just speak from experience of being in the field in the Northeast. So I'm based on the Northeast, kind of covered a New England area. So in my little niche of the world, we had a lot of ophthalmologists, inherited retinal disease, the big like IRD clinics, retinal specialists. So if you are diagnosed with an IRD by an ophthalmologist or even an optometrist, I have glasses. So if I went to my optometrist and, met certain criteria for retinitis pigmentosa or one of the other IRDs, most likely I would be referred along to a specialist, an ophthalmologist, a retinal specialist particularly. Some of those centers have their own genetic counselors in-house. Some of them don't. And the testing itself is usually kind of ordered in conglomeration. We're not seeing as many general practitioners. It is more kind of specialized in the ophthalmology space. And then for those clinics that don't have a genetic counselor in-house, we've partnered with Informed DNA, another one of our partners of the MRT program, that the Informed DNA counselors are able to provide post-test genetic counseling services to patients, again, at no cost to the patient. I bet I got a feeling that Cal has some some things to say about Informed DNA.
I do. I have so many comments to make. So on the topic of Informed DNA, yeah. So again, I'm in the Northeast. Like there is plenty of genetic counselors, right, in our urban areas that have the expertise to really speak to the type of results we're talking about. However, that's not the case in necessarily the rest of the country. So, and I don't work for Informed DNA, I work for Blueprint, but Informed DNA, the way that the genetic counselors who are there work is by specialty, and certainly there are genetic counselors who specialize in ophthalmology or eyeballs. That is their bread and butter. They have the deep knowledge. And so pre-test, post-test counseling, we've partnered with them in order to provide access to genetic counseling services for those clinics that don't have a genetic counselor that specializes in this, or even access to a general genetic counselor. And so I think that what the Informed DNA or places like Informed DNA provide is that comprehensive counseling that you might not be able to do because you're not as savvy with the genetics piece of it, or able to interpret some of the more complex types of reports that are issued. And the great thing is, especially in this telehealth age, they do it by phone, they do it by, apps. And so that's my comment about Informed DNA. I just had to go back to another comment about access to care. Like here we're talking about like who is ordering testing. I mean, anecdotally, similar to Ariana, I'm seeing a lot on the lab side, seeing a lot of ophthalmologists. And one of the reasons is because in order to be eligible, like if we want to think about eligibility criteria for testing, patients have to have a certain diagnosis, which by and large is done by an ophthalmologist, like a specialist. And so a GP or an optometrist might see something and say, ooh, I think it's this. And in all likelihood, they're going to refer to ophthalmology. They'll do the formal diagnosis, like stamp it, like, yes, I think you have this. And that's the basis for the eligibility criteria to do the testing. So I think that's why we're seeing the types of ordering practices that we are, versus like a general practitioner or a GP type physician, clinician ordering our testing.
Right. You have to, as we started the show saying, you have to have a diagnosis to then have the testing. It's not for undiagnosed people. It's for people that already have a retinal diagnosis, and we're trying to figure out, okay, what's the exact genetic change that's leading to this? Or, is there one?
Exactly.
So with my research with this, I came across the term iDNA. Can you guys explain to me what iDNA is? Because, I've heard of lots of things, but I don't know if I've ever come across that one before.
Yeah, iDNA is just, I think, a shorthand. If we're talking about the same thing, it's a shorthand that we use for Informed DNA. So it's just kind of the shorthand for Informed DNA. They call themselves iDNA counselors a lot of times. But yeah, they're our partners here for the My Retina Tracker program, and our partner for another sponsored testing program we offer in the hearing loss space. They're an amazing resource, to patients and providers all across the U.S. That's an important thing. I was piggybacking off of Cal when we talk about eligibility criteria. Eligibility criteria for the My Retina Tracker program, in addition to that clinical diagnosis of an inherited retinal disease, patients also do need to live in the United States or a U.S. territory. However, to participate in the My Retina Tracker registry, patients can live anywhere. It's an international registry. It does not require a U.S. address or anything like that. If you have that molecular diagnosis, or even if you don't, you do not need to live in the U.S. in order to become part of the registry and, benefit from the myriad resources that the foundation supplies to the IRD community.
Want to become a genetic counselor? Looking for ways to engage with the field and boost your resume for grad school applications? Then you should check out Sarah Lawrence's Why Genetic Counseling Wednesday Summer Series. Every Wednesday this June, Sarah Lawrence is hosting this series where you can interact through Zoom with genetic counselors from different specialties. It kicks off on June 1st. You can sign up at slc.edu/DNA today. Again, visit slc.edu/DNA today to register to level up your resume for applications in the fall. Did you know PerkinElmer Genomics was one of the first laboratories to offer whole genome sequencing on a clinical basis? Whole genome sequencing can maximize clinical diagnostic yield for patients. With turnaround time of 4 weeks for the proband sample, PerkinElmer's whole genome sequencing test is designed to provide access to additional valuable information compared to an exome. PerkinElmer also offers prenatal whole genome sequencing as well as ultra-rapid whole genome sequencing for critically ill newborns using dried blood spots. The ultra-rapid genome has a turnaround time of 5 days and includes mito, chromosomal CNV analysis, STR-TNR screening, and biochemical analysis. Also, listen back to episode 176 with Dr. Madhuri Hegde, where we explored the power of whole genome sequencing, which also happens to be one of my favorite episodes of DNA Today. And stay tuned for a couple more episodes with PerkinElmer soon. Discover all that PerkinElmer Genomics has to offer at PerkinElmerGenomics.com. And when we're looking at the panel that's being ordered, how many genes are included on that panel so people are aware? Because panels really range from 2 conditions to hundreds of conditions. Yeah. Even 1,000, I think I heard recently, and I was like, 1,000 gene panel? Oh my goodness, that's a lot.
Cal, do you want to maybe?
So the panel, correct me if I'm wrong, panel screens for 351 genes currently. And all for the indication of inherited retinal disease. So the fun part about genetics is we have genes in there that might be associated with perhaps different types of eye disease. In this case, the MRT panel is designed with 351 genes that we know are associated with retinal disease and are interpreted as such. So when we look at the variants that come up, we're interpreting the variant significance in light of a clinical presentation of retinal disease. And sometimes that gets a little confusing because you might see a gene that codes for 16 other things. Yep, that gene totally does. We're only looking at it from the perspective of retinal disease in this case.
Interesting. So it's just looking at that, which is a lot of genes. That's a fairly large panel. One thing that I'm thinking of coming from the prenatal perspective is certainly conditions that we mentioned at the beginning. I think Ariana mentioned like Usher syndrome. That's something that at least certain types are on carrier screening. So I might have parents coming up as a carrier for those conditions like Usher. If I had a situation where parents found this out, both of them are a carrier of Usher, so baby has a 25% chance of inheriting Usher, and they're continuing the pregnancy, would they be eligible to do this testing at birth, or would they need to be getting a diagnosis from an ophthalmologist or something ahead of time? I'm thinking through a case in my head, this makeup case.
Yeah. It's such a great question, and I think it really comes down to the difference between screening and diagnostic tool. And the purpose of our testing is diagnostic. So we're not screening healthy population, unaffected individuals to determine whether they might have a predisposition later in life to develop, or it is diagnostic. So in order to be eligible for the My Retina Tracker program, of course, we don't want baby with the 25% chance to go on to develop Usher syndrome. But if baby did end up, presenting later in life, they would at that point be eligible. But at birth, without any of the visual acuity information that's part of the eligibility criteria process, unfortunately, at that point in time would not be a good fit for this particular program.
But good for
Yeah, I was
parents
like,
to be
wait a
aware of
minute.
it as an option down the road if needed.
Totally.
Did I beat Cal to the point?
Well, no, I'm taking it in a different direction. So say we know that there's a 25% risk and the patient ended up getting tested through, say, targeted testing and got a positive result, that would make them eligible for the registry, right? So there's kind of I'm like still wearing my registry hat here and trying to get patients in there. And so that would make them eligible based on that result for the registry, if that's something that the parents wanted to meet, kind of participate in that kind of community.
Yeah, certainly a good resource for prenatal genetic counselors to be aware of, as that might come up of saying, okay, well, if baby does end up having Usher syndrome, then this is a whole great resource in testing that we can do after diagnosis and being part of a registry for clinical trials. And obviously, different areas with pediatric, obviously, if you're having a diagnosis, going ahead and being tested.
Yeah,
so I think something good for everyone to be aware of. Yeah, go ahead,
We
Cal.
provide resources as clinicians, right? Like you can look at Facebook groups or other types of social media out there, and registries are certainly another place that families can congregate and, if work towards advocacy and all of that. So definitely part of that arsenal of resources that we can give to families.
Yeah, certainly. Well, anything else? Yeah, go ahead, Ariana.
Yeah, part of the information session that we're developing, this My Retina Tracker registry information session, a part of that session, in addition to getting registered or enrolled in the registry, is talking about all of the different resources that the FFB provides the IRD community. So registry is just one piece of the puzzle, and genetic testing is another piece of the puzzle. And, what are some of the involvement on the patient advocacy side? Like just really understanding like what's out there for patients, getting that diagnosis or not getting the diagnosis. I can't even imagine how challenging, that is. So really the purpose of everything that we're doing with the foundation, the development of this information session process, is to make this information a little more digestible to patients, to give them some hope for the future, to give them some next steps on things that they can do to kind of, control their own medical, information. And we're really, really excited to be part of the partnership and have this program hopefully, available to more and more patients every single day, if not, month and year.
And it's fantastic that Blueprint offers this along with all of your other partnerships like Inform DNA and everything, just to be able to offer this to patients and that they don't have to pay, because, genetic testing is getting cheaper as the days go on. Honestly, I'd say years, but it's really days. It gets cheaper, but it's great that that's not even a consideration that people need to be in their decision making. It's just, do you want the test or not? And it's not about the cost for the patient, which is just fantastic, and everything that you offer. Any other closing thoughts for today? I certainly have a lot to digest here on my end. A lot of great information.
Find a registry near you is my message.
Yes, that's Cal's soapbox. Go find a registry.
There's, I guess, just a plug, there's a lot of great resources and information on both our webpage at blueprintgenetics.com. The My Retina Tracker program page has is a wealth of knowledge, and the Foundation Fighting Blindness webpage as well has a lot of information specifically about the registry. It's the landing page for how to log in. So for anybody who's interested in learning more, I would say follow the link in the bio, but there are no bios and no links here.
Link in the show notes. You're close.
Oh, good. I wasn't too far off.
Yes. You've got the lingo now. Yeah. So you guys can head over to the show notes. If you're listening to this in a podcast app, just swipe right. All the show notes should be there. Or you can go to dnapodcast.com and we'll have all the links to that. Or just go straight to blueprintgenetics.com, whatever's easiest for the listeners. But Ariana and Cal, thank you so much for sharing all of your insight on this. I'm looking forward to seeing what information, we're learning from this, and especially the clinical trials that are going to be coming out of this and matching people from the registry. I'm sure I'll hear from you guys and say, wow, we have this clinical trial, we've had success. And yeah, we'll definitely have to loop in the listeners and let them know all the updates with Blueprint.
Thanks
for having us, Kira.
It was awesome.
For more information about today's episode, visit dnapodcast.com, where you can also stream all episodes of the show. We encourage your questions, comments, guest pitches, and ideas. Send them all into info@dnapodcast.com. Search DNA Today on Twitter, Instagram, YouTube, Facebook, so you can connect with us there. And a favor, please rate and review the podcast on Apple, Spotify, or wherever you listen. This truly helps us climb the charts and allow more genetic nerds like yourself to find the show. DNA Today is hosted and produced by myself, Keir Deneen. Our social media lead is Corinne Merlino. Our video lead is Amanda Andrioli. Thanks for listening, and join us next time to discover new advances in the world of genetics.
The genes of you and me, the genes of you and we're all made of DNA. We're all made of the same chemical DNA.